Good morning. Welcome back to Daybreak on this 11th day of May 2020. And it's time that I want us to take a look at what has been happening in the UK. Of course, you know that the cases there have been rising. But before we do that, let's just take a look at what's happening in the country with some of the slides that we have. And we know that so far we have about 672 cases of coronavirus. If we can have those slides on the screen, you have 672 total infections in the country. Out of these, 32 people have died. 239 have recovered, and therefore the active cases are 401 in Kenya. Then the next one is that so far we know that this is the past 1 week has been the worst. This is the week that we recorded 207 cases. Of course, on Sunday, the other week, we had 465 cases. By the end of yesterday, we had 672. So you can see there are also new deaths within that week to reach 32 now. If you can go to the next one, we see how the weeks have been behaving. The first 10 days of the pandemic, we had 15 cases. The second week, we had 27 cases. Week 3, 100 cases. Week 4, we went down a little bit with 55. Excuse me. And then after that, on the fifth week, 73 cases. Week 6, 85. Week 7, 110. And now the past 1 week, 207. So we do not know where we will be heading this new week. Let's take a look at the situation in the United Kingdom. The total infections that have been reported so far, 219,000. There are a few hundreds above that. And then for the total deaths, they have registered 31,855 deaths as of last evening, and more coming in. Now, the deaths globally, we have 281,000 people that have lost their lives to the pandemic. Most of them, or the high number, is in the US, which has contributed 80,000 deaths. In the United Kingdom, which is following closely with 31,855, and Italy follows with 30,395. And the reason why we put that into perspective is because this morning we are speaking to Tabitha Kavoy, who is a public health specialist in the UK. And the last time, Tabitha, we spoke to you, that was on the 23rd of March. The numbers were looking pretty not so bad that time, because it was about 5,600 cases reported at that time. Now, excuse me, just less than 2 months later, we are reporting 219,000 cases. The deaths have gone way up to the 31,000. I mean, what has been happening the past a few weeks, now almost 2 months?
Yeah, good morning, Sam. It's nice to catch up with you again. You're right. I mean, we spoke on the 23rd of March, and the deaths at the time were just 281 deaths. And a few weeks later, that has moved to 31,855. So this just has to show you how infectious or how dangerous this virus is. I mean, COVID is taking on, and it just shows how quickly things can change. I mean, let's not forget, with this 31,855, behind these numbers is people who've lost their loved ones, it's people who've lost a mother, a father, a sister, a brother. So it's just not numbers, it's families left behind mourning, it's people left losing their loved ones. So obviously it is a very, very sad situation, definitely. I mean, there's been some explanations to this, you know, there's plausible explanations that people have put out there on why this number could go up. But, you know, at the end of the day, I think it's recognizing it is a very serious virus. Things could change within a very, very short period of time. And obviously, we need to be very keen, and we need to really fight this virus.
Right, and obviously one would wonder, because of course we've seen the measures that have been taken by the government of the United Kingdom. Where has been the gap, so that yes, it's infectious, but then the infection rate has sort of been pretty high. We'll shortly be looking at some of the slides that you shared with us. What has happened?
I think saying what has happened is it's a complex, and it's a mixture of different things. Obviously, people have had different explanations to this, and it will be interesting when we are past this fighting period, to look back and see what could we have done better, or where the gaps are. But obviously, UK is a very dense populated country. You know, there's over 66 million people. There's a huge number of aging population. I mean, 18% of the population is over 65, and it's very urban and densely populated. So that's a plausible explanation. Secondly, you know, there is questions on, could we have done lockdown earlier? Could we have taken different measures? Could we have had a better grip on our international travel and probably imposed measures like quarantine. So there is plausible questions that are being asked, and it's very difficult. I think you can't point this to one factor. I think it's a complex situation. It is different factors coming up together that could potentially lead to this, to these numbers where they are. Now, of course, there are measures that were taken. I think when I spoke to you, the day after that is the day we went on lockdown and were allowed one exercise a day, social distancing, and all of that message. And I think, from a public health perspective, this works. I mean, the science is if you're not coming into contact with the virus, then you cannot get infected. So social distancing works. Public health measures like hygiene, hand hygiene, washing of hands, respiratory hygiene, making sure, covering your face not to spread the virus. All of those things work, and they have worked. I mean, we've seen the numbers since the measures have been put in place come down. So definitely these measures work, and I would say that it's important that we keep putting this public health message out there and putting these measures in place to prevent further spread.
All right. And yesterday we heard from the Prime Minister of the UK, Boris Johnson, indicating that they will not be lifting the lockdown as yet, saying that schools may reopen sometimes, I believe, towards the start of July or thereabout. And also there could be some let-off starting June.
Yeah.
Yes. So what exactly are these measures that are to be taken that haven't been taken in the past couple of weeks?
So I think what you saw from the Prime Minister yesterday is a very cautious approach to lifting lockdown. I mean, as you've seen in other countries like Germany where they've been lifted, we are seeing the rates coming up. Now, what the government did, they put 5 tests or targets that needed to have been met before we start lifting lockdown and before people start getting back to normality. And the one thing I must mention, Sam, is, the numbers are high and it all sounds doom and gloom. But at the end of the day, we are definitely past the peak. I mean, when I showed the epidemic curve the last time I spoke to you, you can see that around April, the numbers were really high. We were talking about 1,900 cases a day, and the last few weeks they've gone down. I mean, yesterday we only had 239 deaths, and yes, they are deaths and they are important numbers. So what the Prime Minister is saying and what the government is saying is, obviously there's a lot of caution. People have to be careful on how they lift these measures, because obviously the numbers have gone down because of lockdown. So he's put in a roadmap, really, it's a 3-stage process on how we could come out of lockdown or how people could get back to some sort of normality. And what we're seeing from today is, people are allowed to go out and exercise more than once a day. Before it was once a day. You're only allowed to go out to exercise once a day and go out for go out when it's essential, for example, to get food or medicine. Okay. So now people are being allowed to go out and exercise more. People are being allowed to go to work if you cannot work from home. So these are people like construction workers, people working in manufacturing, in the front service, like shop floors and things like that. So people are being allowed to go where they cannot work from home and being encouraged to use private transport as far as possible. And then they're monitoring this closely, so that they're not just lifting the lid and saying, hey, the numbers have gone down, I can go back to normality. So that's the only immediate change at the moment. And then obviously in stage 2 is 1st of June, where they're considering reopening some schools. So they're obviously prioritizing those pupils and students who are in their last year of education. And so and then in July we'll probably see some opening of some shops and leisure. So it is very staged. It's conditional. So if the numbers are going up, that could change. So it's a very, very a cautious approach that we're seeing.
All right, and Tabitha, there are some slides on the screen. The first one that talks about an R, that you're talking about the reproduction of a virus. I mean, just tell us about what that means, because I hear that Germany's R is now about 1. There's some countries that have up to 3. So what does that mean, and how does it help in controlling the spread of this virus?
Okay, so an R number is a reproduction number, and basically in simple terms, what that means is how many people would get the virus if they came into contact with someone with the virus. So for example, if someone had the virus, how many people would they give that virus or would contract the virus from them? So for example, if you had COVID and the number when COVID started was 3, meaning if one person was infected, they would give it to 3 other people. And those other 3 people each would give it to 3. So it goes up to 9 and that way. So the R number is an important number when it comes to public health and epidemiology, because it's sort of, if the R is more than 1, that means someone is giving the disease to more than one person. And there's the graph rightly saying, if the R is 1 or if it's 2, you give it to 2 people at any given time. And those 2 people give it to other people, so it doubles to 4, and it goes on and on and on. So it's a very important number because you want the R number to be less than 1, really. Because if it's less than 1, as the graph shows, you're giving it to one person, so that person gives it to another. So it's less and less and less. So the target, really, for example, the R in the UK at the moment is between 0.5 to 0.9. And as you can see, that's a huge interval, and people have to be cautious because you want to have the R very low so you can give it to less people, and that way the disease is contained. So the higher the R number, the more infectious the disease, the more people get it. The less the R number, the less people get it.
And Tabitha, just how do you calculate that number?
So it's different for different infectious diseases. I think it's an epidemiological calculation, and it's based on different things about the different viruses. So, for example, different diseases like measles has an R number of, for example, 18. Other SARS, different infectious diseases based on the factors and how infectious the disease is get that R number, but it's an epidemiological calculation.
Well, I am not satisfied with that answer, but all the same. So let's talk about, of course, now we know that, for instance, in Kenya, part of the challenges in establishing how many cases we have has been to do with the testing. How is the testing regime in the UK? How many are being tested? Because earlier on we had a report from the UK High Commission in London, the Kenyan High Commission in London, saying that most of the people that are being tested are those that are sick or in hospital.
Okay, so the testing regime has changed over the period of the virus. So as you can imagine, every country will have a lab capacity, and the government has had, and public health obviously has had to make a prioritization on who gets tested and where does the testing help. Because you've also got to remember of the type of test. So the test that's currently commonly available is the antigen test. And what I mean by the antigen tests is it tests at that time if you've got the virus or not. It's not an antibody test that tests if you've had the virus before and you've got antibodies. So it tells you at that particular time if you've got COVID-19 or you haven't got COVID-19. So obviously, because it's a high population, the virus is spreading very quickly, there's been prioritization on who gets tested. So when we began, the lab capacity was about 20,000 a day, and they prioritize testing people who are in hospital, who are obviously symptomatic in hospital, and hospital key workers. But we've seen over the weeks that lab capacity has increased and has hit 100,000 a day. And again, there is prioritization on who gets tested. So for example, it's been opened up to people who are over 65, basically because we're seeing this COVID-19 is affecting the elderly or the over 65s. Key workers, so by key workers is a long list, people working in the shops, the cleaners, people working in hospitals, people transport, so people who are keeping the country going, really. And also, we've recently, in the last few weeks, they've opened it up to the social care sector, and what that means is care homes, because obviously we've got aging population and a lot of people live in care homes, which could be a hub for infections. So they've opened it up to the care homes, and in the care homes, actually, it's people who are symptomatic and asymptomatic, as we see that COVID people could have COVID and not present with the symptoms. So every day there's review of the system. So it's people over 65, key workers. If you're living at home and you're a key worker and there's someone with symptoms, obviously you can get that test, and there's different ways you can get it. You can go to hospital, there's regional testing centers, there's mobile testing centers, and we are seeing this capacity increase day by day.
And obviously we've seen that the UK is not able to meet the 100,000 daily target. When a Kenyan hears of that, it's pretty Interesting, bearing in mind that we are only able to do just about 1,000 or less most of the days. But even as you talk about that, what is the biggest challenge when it comes to testing? Of course, everyone would want to test as many as they can. What is your challenge like in the UK?
Obviously, the demand for testing has gone high and globally. So you've got to, the labs need the agents, they need the reagents to test. So they need the materials to do that. So obviously, and also the type of test we are having, it's a PCR test. So this requires materials, and globally there is a huge demand for those. And like every other lab, I mean, people in the lab will understand there's always challenges. So, I mean, it's not been a smooth ride. We've had people have had to be a bit clever on how they increase that capacity, include private laboratories, and have people working together, just not on the government facilities. So there's been a lot of creative, working together and making sure that people can increase this capacity. But definitely there has been challenges with reagents and things like that.
Mm-hmm. All right, so we'll shortly be listening to the Prime Minister of the UK, Boris Johnson. If we have that clip, we can run it now. Listen to what he had to say as far as the measures that he announced last evening.
When I think of the millions of everyday acts of kindness and thoughtfulness that are being performed across this country and that have helped to get us through this first phase, I know that we can use this plan to get us through the next. And if we can't do it by those dates, and if the alert level won't allow it, we will simply wait and go on until we've got it right. We will come back from this devilish illness. We will come back to health and robust health. And though the UK will be changed by this experience, I believe we can be stronger and better than ever before, more resilient, more innovative, more economically dynamic, but also more generous and more sharing. But for now, we must stay alert, control the virus, and save lives.
Stay alert, control the virus, and of course, announcing those measures that he's talking about, preaching some resilience. But then again, there's a slide that we have that talks about the death toll and how it's been growing. You referred to it earlier on, but if you look at that, how the numbers have been sort of, if I may say, dancing to what we have now on the 9th of May, not so bad, 346 going down. I mean, when you look at all these deaths, are they all hospital deaths, or are there cases of people that have died at home, and how are you recording that?
Okay, I think an important point to bring some, because obviously different countries have different measures of recording deaths. So I think when we compare deaths, we also need to be aware and conscious that, different people are testing differently and are recording differently. So when you look at those numbers in the UK, you'll see that it's a red graph and a blue graph. And the red graph is people who've died in hospital, and the blue graph is people who've died out of the hospital. So there are deaths, obviously, for us to register, for that death to appear as a COVID death, it's got to be registered. Our registrar has to confirm it's a COVID death, meaning there has to be testing that has been done to confirm that someone has had COVID-19. So potentially there could be more deaths if people have not had the opportunity to get testing and have probably, unfortunately, died at home. So people need to treat these numbers with a lot of caution, but also understand they might not be fully representative of the full picture. Because if you've not had a test, if you've been very ill and unfortunately not made it to the hospital, or not had or have died without a test, then those numbers could look very different than they do now. So obviously the numbers have been dancing, but as you can see, the curve is we are definitely past the peak, and I emphasize the fast peak. So we don't know how this will behave once we start getting back to normality. So there's a lot of caution about that, and we'll be closely monitoring that to change any public health interventions accordingly.
Interesting that Rachel said you're past the first curve, the first peak, and obviously everyone is hoping that the first peak is the last one. But then again, here in Kenya, there has been cessation of movements in some of the cities, some of the counties. If you talk about Eastleigh in Nairobi, if you talk about Old Town in Mombasa, and people are finding it rough, bearing in mind that they have to go about their businesses and bring some food on the table. What would be your word to speak to Kenyans from a perspective of a country that has gone through so many deaths deaths, so many cases reported within a span of just a few weeks?
I mean, it is tough. It is tough. And obviously, as I said before, behind these numbers is families. Behind these numbers is people losing their loved ones. And obviously, as any other disease, COVID is obviously more affecting, people where there's health inequalities, it affects the most vulnerable. So as you've seen and as you experience in Kenya, there's people who cannot work from home, who find this a challenge. There's people who definitely have to go in. And the government and the Harambee Spirit I referred to last time, everybody has to play their part. And I would urge where people can, where they can, and I do get it that it's very hard, is to just follow the public health advice, because the more we can do this together, the more people can cooperate, the more the disease, or the virus can be controlled, and the quicker people can get back to normality. But also, let's not recognize that there is, members of our Kenyan population that will find this extremely more difficult, will be in more challenging situations, will have, less permanent job, temporary jobs. And obviously, it's also important to put in the public health officers in the community, in the counties, who know the communities very, very well, and come up with more innovative ways of supporting these communities so they can adhere to the guidelines and be able to control the virus. But so far, the reports, it seems like Kenya, people are adhering to those. I've got a family back home, and all of them have traveled to the village, went to the village in Masi and were in lockdown there and are adhering to that. So there is that, and I would just urge people to be a little bit more patient, careful, cautious. Everybody play their part, and hopefully, people can come together and do that, and involve the public health officers. They know the communities, they've dealt with infections before, and they will be able to bring a lot of expertise into those communities and target where there's those issues.
And lastly, Tabitha, there's that anxiety from your motherland here. Obviously, people saying that they do not know for how long this will be. And like I told you, there are those that have been feeling, we think the government has been able to control this, so they're dropping the guard. What would you tell them as we look forward into the next coming weeks and months?
I think I would say, let's not drop the guard. I mean, sitting here and looking at those graphs saddens me. It's real. COVID-19 is real. It's dangerous. It's taking lives. And I think the perspective, because when I spoke to you, as I said, we were at 281 deaths. We were once at the Kenyan rate, and look where we are now. So I think it's very, very important for people to recognize that, all these numbers we're talking, 30,000 were once 289, 81 were once one number, one death, and to play their part and just hold on. But also, I think we've got the, big national interventions. I think it's important to target different populations with different needs. For example, people who have to go to the farm and work, or frontline workers, apply social distancing. So we need to be creative. And I think that's why I insist, and I see public health comes in there. Local public health officers come in there to target those communities. They know them really well, some. They know how to speak to them. Health education, community-based groups that know these populations, but also see the why. Why are people letting off their guard? Is it because they're desperate, they have to go out? Is it because, they have to go and feed their families? So we have to recognize, and obviously the government has to come in and put measures in place to support those communities. But my fellow Kenyans, I would say, it's real. These numbers are real. It's people's lives. Let's not let the guard. Let's follow advice. But also, the other thing to mention is clarity of the messaging. It's important that it's a simple message. It's a clear message. People understand why people are supported, and hopefully, people can come together and play their part. And I pray that we never see these numbers go up in Kenya as we're seeing it elsewhere.
Tabitha, I was hoping that you'd say that in Swahili. Do you want to try?
Of course I can say it in Swahili. Watu wakae nyumbani. Tuendelee kusikiliza vile serikali inatuambia, public health, kuosha mikono, kufanya social distancing. Na Wakenya kweli, hii COVID-19 is real. Kwa hivyo tuendelee kufuatilia vile serikali inatuambia, na kwa kweli tukiwa na umoja tutaweza kushinda COVID-19.
Haya, asante sana Tabitha Kavoi kutoka jijini London kusema na sisi asubuhi ya leo.
Asante.
Haya, kila la heri. And now we take a short break. When we return, Zinzi Kibik will be driving that conversation with the Cabinet Secretary in charge of devolution, that is Eugene Omala. They'll be talking about the situation we have in the country of floods. Over 29 counties already affected by the floods. Several people have lost their lives. She'll be talking about the measures that are being taken and the response that the government has been putting in place. We're back in a moment.